Did you know that every year dehydration kills millions of people across the world? And dehydration is really one of the leading causes of death in children. That is why you need to know how to prepare your oral rehydration solution at home. Hi there and welcome back to my YouTube channel. It's Marvel Pharmedy here, and today is going to be a do-it-yourself video, a DIY video on how to make ORS at home. What is ORS? Oral Rehydration Solution. So when you hear ORS, what's the first thing that comes to your mind? For me, it's the oral rehydration solution, or you could also call it ORT, which is oral rehydration therapy, or you call it the salt sugar solution. But before I talk about how to make ORS at home, I'd like to share a little about dehydration. So dehydration is the process where your body doesn't have enough water or your body loses water. Dehydration occurs when there is not enough fluid in your body. And this could be as a result of underlying disease conditions. It could also be as a result of sicknesses like diarrhea, vomiting, or even when maybe you're stressed or you carry out exercise and you do not drink enough water. And dehydration ranges from mild to moderate and to severe. For mild dehydration, it could start out as dark colored urine, feelings of headache, dizziness, and gradually you would begin to see signs like paleness. And the moment you notice that the patient or the individual has sunken eyes, cracked lips, extremely dry skin, or skin that when you pull the skin like this, it doesn't return immediately. It takes like 2 seconds to return. That could be a symptom of dehydration. And dehydration occurs especially in children and has resulted to millions of deaths globally in the past years. And it's important that you know what to do if a child is dehydrated or an adult is dehydrated at home. And that's why I'm going to be showing you how to make ORS solution, the ORS, that's the oral rehydration solution, at home. So keep watching this video. ORS has carbohydrates, minerals, and electrolytes that helps to balance the body fluid levels. That's what ORS is. And it exists in sachets, in powders, and you could also make it manually at home. That's what I'll be showing you how to do today in this video. Before I proceed to showing you, let me also remind you that ORS should never be given to patients who are unable to swallow normally as a result of another underlying disease condition. It should be used in caution with patients who are diabetic, have heart diseases like hypertension, and you need to communicate with your healthcare provider, your pharmacist, your physician, before you take ORS. It should also not be used in severe dehydration. That's the extent where maybe the child is malnourished or the adult is malnourished. In that case, intravenous fluid replacement might be better, so you need to rush the child to the hospital or the adult, as the case may be. That's when you notice sunken eyes, cracked lips, weight loss, visible weight loss, extremely dark colored urine. Though in that case, you have to rush the patient to the healthcare facility. Let me also say that ORS comes in different flavors, and you could also have the plain ORS. Just consult your healthcare provider, visit your pharmacist, and the person will tell you what works best for you. For children, the flavored ones are usually more advised because they are sweeter, and adults might just prefer the plain ones. Another thing I'd like you to know is that ORS could lead to side effects like vomiting, nausea, and abdominal pain in some patients. And overdose or abuse of ORS could lead to extremely high electrolyte levels, which is electrolyte imbalance. It could lead to seizures, and that is why you do not just have to take ORS because it's sweet. So in today's video, I would be showing you how to make ORS from the comfort of your home. In my hand here is a bottle of water. This is 1 liter of clean water, water that has been properly cleaned, drinking water. So this bottle here, I'm sure a lot of people can recognize this. This is Eva water, and this is the 150 cl, which is 1.5 liters. So measuring it to here, this is 1 liter in this bottle. And if you're not with a measuring cylinder like I was, you would decide to use your eye to measure it. The place where the label stops, that's exactly 1 liter in the Eva bottle. And here I had already measured out my 6 teaspoons of sugar and 1 teaspoon of salt. So fun facts, who else can differentiate? Okay, aside the quantity, how can you differentiate between salt and sugar? The granules are slightly different. So I'm going to be pouring that into my water bottle and shaking to mix. Shaking, and my ORS is ready. Just little sips and the patient will be fine. Another thing I want you to know is that you must discard ORS after 24 hours if it is unfinished. And another thing I'd also want you to know is the fact that it should be used with caution because it's a medication. Remember, every drug is a poison. It's the dose that determines how it would be for you. And always talk to your pharmacist for any medication needs. I'm Pharmacist Marvelene of Marvel, Pharmedy and more. And if you have not subscribed to my channel until now, I don't know why, and I don't know what exactly you want me to do for you. Subscribe to my YouTube channel, like, share, follow me on social media as Marvel Pharmedy or Marvelene Ecot, and I am here for you. Remember, on this channel, every Monday, I share beauty and lifestyle content. Every Wednesday, I share DIY videos and skill acquisition videos. And every Friday, I share pharmacy gist. So when you're preparing ORS, according to dietitians across the world, my interaction with them, and also as a pharmacist, it's best to use just salt and sugar in a liter of water. 6 teaspoons of sugar, 1 teaspoon of salt in 1 liter of water. Shake very well to dissolve, and it's ready to be served in little quantities to the patient. Sips till the patient is better, and it's discarded once it is up to 24 hours. Bye for now, and see you in my next video.